Welcome to the University of Cape Town Pesticide Discussion Forum. I'm Professor Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa, and you're all most welcome. I'm trying to close a whole lot of screens. There we go. So do please continue to introduce yourselves in the chat with your name, organization, and country, and you are welcome to also indicate which stakeholder group you represent. It always gives us a good overview. So the University of Cape Town's Pesticide Discussion Forum is funded through Sweden, through the Swedish Chemical Agency, and we acknowledge and thank them for their funding. I'd also like to acknowledge Natasha Lalou, who is in the background doing the technical and administrative support. If you do have any technical issues, please do go to the WhatsApp group. The link will be posted in the chat, and you will get support there. So for those of you who are new or perhaps have forgotten the purpose of our community of practice, the Pesticide Discussion Forum is to bring representatives from different regions, sectors, and stakeholder groups together. And you can see on the screen that we do have representation from a variety of organizations. If you've clicked other, perhaps you want to indicate which sector you represent in the chat. And what we're trying to do is foster a mutually supporting consortium of stakeholders to discuss various issues related to pesticides, and really to try and build the capacity of regulators, researchers, and NGOs in low and middle income countries, and to discuss emerging issues related to pesticides. And today, of course, we'll be talking about highly hazardous pesticide and the proposal of a global alliance. So we hope to achieve this community of practice goal by learning from each other, sharing information and data, identifying gaps, and problem solving collectively, really to prevent pesticide poisonings, chronic effects, environmental contamination, with a view to a toxic-free future for the next generation. So it's not a webinar. We really want to hear from you. It's a discussion. It's a non-partisan group, so we might not agree with each other, but we'll respect each other's viewpoints. When you do make a comment, Naomi will be renaming you to add your countries after your name, but if it's not there, perhaps you can put it in the chat when you post a question. So we have one presenter today who will be taking us through a presentation of 3 questions. Could we have the next slide, please? And the topic that we will be doing today is pesticide suicides and looking at the impact of global inaction and regional action on regulating highly hazardous pesticides. And we're very honored to have Shweta Dabholkar with us. So if we can have the next slide. So Shweta is a project and policy officer with the Center for Pesticide Suicide Prevention, which is based at the University of Edinburgh. She coordinates the center's regional work in Asia and Latin America, and looks at regulatory approaches with governments, and chairs monthly meetings with colleagues from the FAO and mental health and chemical safety departments from the World Health Organization. She's previously worked on a research project that evaluated zero-budget natural farming. And prior to working at CPSP, she also worked on the Jameel Poverty Action Lab in South Asia. She has a master's degree in anthropology and development from the London School of Economics and Political Science. And she's the 2015 British Council Scholar Awardee. So for a young person, she's achieved quite a lot. So Shweta, thank you very much for taking your time today to lead us through this important discussion. You are welcome, if you can, to turn your video on. Otherwise, I hand the microphone over to you. And next slide, please.
I think my video is on if everybody can see me and hear me.
Perhaps the others can. I'm afraid I only have a dark screen, but that's fine.
Yes, there you can go ahead. I see and hear you.
Okay, all right. Thank you. Thank you so much for the introduction, Andrea, and the opportunity. Good afternoon, everybody. I will be, in my introduction section, I will be first explaining the relationship between highly hazardous pesticides and suicides. And then I will be discussing the impact of global inaction and regional action on regulations of highly hazardous pesticides. So there is difference in the levels of intentions of suicides for different people. Next slide, please. Natasha, next slide, please. Depending on their individual risk factors. In most developing countries, Natasha, next slide, please. In most developing countries, suicides, majority of the suicides are of low intention. It's often a cry for help. Next slide, please. Most of the times it's a cry for help or to seek attention. These are impulsive decisions that are taken without any preparation in moments of crisis. Most of the times after a heated argument with a family member over very trivial matters, such as my mother shouted at me because I scored less marks in school, my in-laws or my husband abused me or disrespected me, my father insulted me in front of all my friends. These decisions are taken in moments of stress over very small domestic issues, and people don't really intend to die. Most of these cases are amongst young people and women. And in these low intention deaths, people don't really intend to die. Next slide, please. Then there are these other types of suicides that are high intention suicides, which are carefully planned. The low intention suicides are the suicides that are preventable through different suicide prevention strategies. Next slide, please. Means restriction or suicide prevention strategies work because suicide impulse is transient in nature. A person can go from no risk to high risk and again back to no risk. Next slide, please. Or again, from chronic risk to increased risk and then again back to chronic risk. But for the individual to come back to chronic risk or no risk, the person has to either not attempt suicide or survive the attempt of suicide. The next slide, please. Access to the types of means of suicides during these increased moments of crisis or risk period amongst individuals determines fatality. For example, if a person has access to guns during moments of crisis, when a person has decided that this is the end and I want to now take my life, and if he has access to lethal means of suicides like guns, there are 90% chances that they would not survive. If they choose hanging as a method of suicide, then there are 80% chances that they would not survive. Next slide, please. And if they choose pesticides, highly hazardous pesticides as a method of suicides, there are 60% chances that they would not survive. So now let's take a moment and think if any of these suicides by these methods, can these suicides be prevented? And the answer is yes, we can prevent suicides if we were to restrict highly lethal means of suicide. Next slide, please, like the guns and highly hazardous pesticides. Because what happens when you restrict these lethal means of suicide is that you allow the person, you give the opportunity to the person to allow the suicide impulse to pass. Next slide, please. And so when the person does not have access to lethal means of suicide during these high risk, during the high risk period of suicide, they either do not attempt suicide because they cannot find anything to take their lives around themselves, or they move on to less lethal means of suicides, like household domestic cleaning agents or medicines. This increases their chances of survival because they don't end up dying, and it also gives them another chance at life through counseling and family support. Next slide, please. Highly hazardous pesticides are a very small minority of all pesticides that present particularly high levels of acute and chronic hazards to health or environment. So we are not talking about all pesticides. It's a very small section of all pesticides that we are asking to restrict. Next slide, please. For example, in Sri Lanka, after the Green Revolution in 1960s, highly hazardous pesticides were very easily accessible to rural people. Because they had easy access to these lethal means of suicide during moments of crisis, there was a sudden increase in suicides after 1960s. When the Sri Lankan pesticide regulators realized that most of these suicides are happening because of pesticides, they started banning highly hazardous pesticides one by one. And every time they banned a pesticide, there was a significant reduction in the rates of suicides. In the 1990s, towards the 1990s, they decided to ban endosulfan and then paraquat, phenethion, and there was a significant reduction in the rates of suicides after 1990s. So we have clear evidence over here that when you ban highly hazardous pesticides, which are lethal means of suicides, you can prevent deaths. Next slide, please. Sri Lanka has been able to save 93,000 lives over a span of 20 years, and the direct cost to government was less than $50 per life saved. Next slide, please. More importantly, banning pesticides did not have any impact on agricultural productivity. Here's the data from Bangladesh, India, Pakistan, and Sri Lanka. In some of these countries, bans were implemented in certain states. And when we looked at the data on the impact of productivity following these bans, we did not see any impact. So there is clear evidence that HHPs are not required in agriculture. There are other safer alternatives, sustainable alternatives that are available. And this is very much possible for countries to ban HHPs. Next slide, please. Pesticide regulations also offer major benefits regarding gender and young people. So here's data again from Sri Lanka. You can see that after pesticide bans in the 1980s, there was a significant reduction in the rate of suicides amongst young people between the age group of from 17 to 35, and especially amongst females. Next slide, please. This also, the same impact has been seen in China. After China imposed pesticide restrictions, there was a significant decline in the rates of suicides amongst young people, and especially amongst women. There is a lot of international momentum to address the issue of HHPs, especially amongst the UN organizations. The World Health Organization has developed a classification system for pesticides based on their toxicity levels. They have clearly called upon countries to ban class 1A, extremely hazardous pesticides, and class 1B, highly hazardous pesticides. The FAO and WHO joint meeting on pesticide management has established a very clear and concise criteria to help countries identify HHPs in use in their country. Under the first criteria, if any pesticide active ingredient is listed in the WHO classification system under class 1A or 1B or in the GHS system, then it is an HHP. Under the criterion 2, if the pesticide active ingredient is known to have any kind of cancer-causing properties, then it is an HHP. Under criterion 3 and 4, if the pesticide active ingredient is known to have any impact on reproductive and genetic systems amongst humans, it is an HHP. And under criterion 5, 6, and 7, if any pesticide active ingredient is listed under the Stockholm, Rotterdam, or Montreal Convention, then it automatically becomes an HHP. There is also a special provision under Criterion 8 that gives the freedom to every country to decide or come up with or identify any HHPs in their own country. Next slide, please. For example, aluminum phosphide. So aluminum phosphide is a fumigant, and it is not listed under class 1A or class 1B of WHO classification system, but it is responsible for many deaths in South Asian countries. So countries can go ahead and ban aluminum phosphide while recognizing it as an HHP. That is what Criterion 8 means. Now, it's also important to understand the impact of each of these international conventions on each other. For example, this year in Rotterdam, a lot of countries blocked listing of several chemicals, citing that if a particular chemical is going to be listed under Rotterdam, then it would automatically become an HHP under the WHO and FAO joint JMPM guidelines. But their main concern about it being termed as an HHP was because in the upcoming SAICM discussions and negotiations that are currently happening, there is a very strong support for the inclusion of a target, which exactly reads, as you can see on the screen, by 2030, the use of highly hazardous pesticides should be eliminated or phased out from agriculture. There is a lot of support for this target's inclusion in the document, and this would impact their trade or any kind of use that they are having of that particular chemical in their own country, because the target is calling for a complete phase out. So when countries decide to block certain chemicals in Rotterdam, they are preventing the chemical from being termed as an HHP, and thereby its eventual bans that are being called in SAICM. Next slide, please. The UN organizations have come up with several documents, and they have organized different conferences to address the issue of HHPs. And the two main instruments or conferences that are important for HHPs is the Rotterdam and SAICM, where countries are failing to reach a consensus, and by default, they reach a compromised consensus. Next slide, please. Now, countries fail to reach a consensus because they have differing national interests. While some countries have banned highly hazardous pesticides in terms of its use in agriculture, manufacture, and trade, there are some countries that have banned highly hazardous pesticides in their own countries, but continue to export it to other countries. And then there are some countries that are manufacturing and using it in both their countries as well as exporting it to other countries. So the national interests of countries is dependent on different factors. For example, pesticide bans in Sri Lanka had a different experience because Sri Lanka is not a pesticide producing nation, whereas India and China are pesticide producing nations. So they have an additional component to think about, which is trade. Next slide, please. Highly hazardous pesticides and these different conventions, therefore, play a very important role. However, when countries decide to not list chemicals under Rotterdam or call upon for compromised targets in these conventions, it does have an impact. Next slide, please. So in the SAICM conference, there is a target that is being currently discussed, and the original text is by 2030, the use of highly hazardous pesticides is eliminated or phased out from agriculture. While the majority of the stakeholders support the original text, there are some stakeholders that have opposed this text and have suggested an alternative text, which reads, by 2030, effective measures have been taken to phase out HHPs in agriculture where the risks cannot be managed, and alternatives with less potential risk for health and environment would be promoted. So the main difference between these two texts is, one, the original text is very clear, concise, and measurable. Anybody would understand the original text. And the suggested text is more on the lines of a risk reduction approach, which is assuming that it's possible to manage the risks of highly hazardous pesticides. By definition, highly hazardous pesticides mean that they are highly hazardous, which means that they cannot be managed. So this is an important component to take into consideration during these negotiations. There is a strong support for the original text, but the way any text is going to be included in the SciComm instrument is only going to be through consensus. And the negotiations are currently happening towards what kind of text needs to be included. So it's a question to everybody. Next slide, please. If there is a level of compromise in the text that countries have to agree to, then to what extent, in your experience, how do international chemicals conventions impact regional and national policies in ensuring their successful implementation to regulate pesticides? Explain your response. Thank you.
Thank you very much, Shweta. I mean, you really covered a lot of information, starting out with the use of HHPs and suicides, and then moving into the sort of international process and also regional examples, which I think is very important. So I do encourage participants to post any questions you might have in relation to what Shweta presented. There is one question from Benedict in the chat. Shweta, I don't know if you want to respond to it. He asks if there's a way to harmonize criteria 8, as it at the moment appears to be quite subjective and country specific. So you are welcome to respond to that if you like. In the meantime, we'll continue responding to question 1 in the chat.
Okay. In my opinion, every country has a different climatic condition and soil type and associated pests. So I think the criterion 8, when they have given individual countries the freedom to recognize the chemicals that are impacting their public health and environmental health, is pretty inclusive. So at least in my opinion, because it gives it gives every country the freedom to decide the chemicals that they think are hazardous, that is inclusive, and I think it should remain like that, because we have the case of aluminum phosphide. It is not listed as a class 1A or class 1B chemical, and it is responsible for several deaths in the South Asian region. So yeah, that's my response.
So we have the first poll on the screen. There will be several polls. So while you continue to respond to question 1 in the chat, and I can see Opone has presented a question. So why can't we hold pesticide manufacturing countries responsible, as they have the power to eradicate the market? I think this is in response to the double standards that you mentioned. Shweta, would you like to respond to that?
Yes. Yes, so that is correct, which is exactly why we have stakeholders have introduced targets in the SciComm instrument that are calling for bans, total bans on chemicals that countries have banned in their own countries. If you banned a certain chemical in your own country, you can't export it. But that's the best way to go about any kind of international regulations. It's not possible to force a country to take a decision on their own. So stakeholders have introduced different targets in the international conventions, and negotiations are currently going on for those. There are also a lot of human rights organizations, and there's a lot of research work that has been done from a human rights perspective that who is responsible for these deaths. And yes, to an extent, you are right that the pesticide producing nations are responsible for this.
So do continue posting your comments in the chat, which I can see people are doing, but also do take a moment to respond to the poll. So you can click on the link that's in the chat and go straight to menti.com, or you can actually go to menti.com and put the code in that's on the screen. And what we're looking for is what you think are some of the gaps with international conventions that you feel need to be addressed in relation to pesticide regulation. Back to you, Shweta, for comments on what you're seeing in the chat.
Yes, I see somebody has mentioned the role of different ministries. I agree that this particular issue is very different because it involves collaboration both at national and regional and also international level between stakeholders from the Health Ministry, Environment Ministry, Chemicals and Fertilizers Ministry, and Agriculture Ministry. It is a multi-stakeholder issue because when pesticides are banning pesticides is a decision. It's a regulatory decision that usually rests with the Ministry of Agriculture or Ministry of Chemicals and Fertilizers. So while its impact is on the environmental health and public health, but in terms of regulating or implementing that a particular law or legislation, the decision really rests in the hands of Agricultural Ministry and Chemicals and Fertilizers Ministry. So it is important for representation in the international conferences from all these different parties: health, environment, chemicals, and also agriculture. And even when these decisions are taken internally within a nation, different ministries, these 4 ministries, should be collaborating with each other to come up with the best strategies.
So I'm not sure if you can see the question from Chris from Zambia, asking with the change that's been experienced in listing chemicals under the Rotterdam Convention, what is your opinion on the criteria of identifying HHPs?
Under the does he mean amendment, or does he mean the JMPM criteria?
So he's referring to listing under the Rotterdam Convention, but the JMPM criteria does list the Rotterdam Convention as one of the criteria. So in other words, if it's listed, as you know, then it becomes an HHP. So given the problems with actually trying to list under the annex of the Rotterdam Convention, do you have an opinion about the current criteria?
I think Rotterdam Convention in itself is a much complicated process, and there is nothing much that is happening there in the past several years. So it is, as of now, and in the past couple of years, it is definitely not helping the process of banning HHPs or identifying HHPs. But I think as an indicator or indicator required for identifying HHP. I think it is important because it helps keep countries in check. For example, if in a couple of years there was any chemical to be listed under Rotterdam, it would be an HHP by default. So yeah, I think as an indicator, it should be there. Right now, we don't see an impact, but maybe in the future, there will be an impact because this year in Rotterdam, there was an amendment that was under discussion for voting. It didn't get through, but maybe hopefully in the next couple of years, it might. So, yeah.
There's also quite a few postings on the poll. I don't know if you feel like switching over and having a look at that and making any comments. I'll, in the meantime, keep looking for questions for you.
That is true. Manufacturers are not held accountable enough. So yes, so if there could be any kind of laws or policies put in place to fine them as well for suicidal deaths or occupational deaths because of pesticides. Also, I see this point on finances, capacity, and technical resources. I think international conventions are important, especially for developing countries and regions that do not have enough resources to implement these kind of regulations. Often in the developed countries where they have over more than 100 people employed in their pesticide regulatory bodies, in most developing countries, there is only one person or maximum 2 to 5 people in the office. So in terms of capacity or also resources, it's sometimes it's not possible for countries to ensure strict implementation. And if there is international funding or support in capacity building, it can help countries come together and act upon this issue.
So Shweta, if you feel you've had a good look at that, we'll move on to the second poll. We will, of course, have a summary of all the poll responses in the digest. So do make sure that you have signed up for the Pesticide Discussion Forum, those of you who've joined today. If you'd like to get a copy of the presentation, the slides, the digest, and also the recording. And thanks to those of you who are already responding to the poll. So has the voluntary FAO WHO International Code of Conduct on Pesticide Management had an impact on pesticide legislation in your country? And I can see some of you are responding. The link is in the chat. If you click on it, it'll take you straight to the Menti poll. So I see Michael in the chat is saying that we need more support from NGOs to conduct awareness raising to support the efforts of countries. And perhaps I can just jump in on this. Part of the problem is NGOs don't receive enough funding. And yet the request is always that NGOs and civil society play quite a huge role in the regulation and prevention of pesticide poisonings. So really, we need to also put the money there and the research. And of course, behavior change is the most difficult. So that's why Shweta's presentation is so important. By removing a few pesticides that are highly hazardous, you actually have a much higher chance of impacting a much larger aspect of society and protecting the environment than you would trying to change individual behaviors. I don't know if you want to comment on that, Shweta.
Yes, I agree with you, Andrea, that it's not only the responsibility of the NGOs, and the NGOs can only do so much. The regulatory decisions are not in the hands of NGOs. Surely they can produce evidence and inform the government, but even to produce the evidence, they need funding, and they don't always have the necessary funding. So at the end of the day, this is a regulatory decision, and which rests in the hands of the governments. And but just by banning a very, very few pesticides or chemicals, countries can save thousands of lives. So why not? I also see somebody has mentioned SAPREF. That is a regional initiative. Similarly, they are also developing currently the EAC strategy. So that is also a very important question, that there is a lot of regional action that is happening today, especially in the African region. There is also a lot of political will or general will amongst policymakers, even in Latin America or even in South Asia, to work on this issue. So if countries are ready to act upon this regionally, to what extent international regulations or international bodies that are meant to address this issue, how are they relevant, and in what ways that they can help? I think we'll get to that point later on during the presentation as well.
Do you want to make any comments on what you're seeing in the poll?
This means, I think most of the people that are attending our webinar today are government representatives, and I think this is a very positive response, and it does mean that these international discussions, conventions, and initiatives to make a difference at country level. So I think that answers my previous question.
Thank you. So would you like to make any summary comments for question 1 before we move on? Otherwise, we can go ahead and move on to your presentation for question 2.
Yes, I think everybody agrees, most of us, not everybody, most of us agree that international regulations are important. It is important for countries to come together and reach a strong consensus to act upon toxic chemicals, deadly chemicals, to help save people's lives and also improve environmental health.
Thank you. So we can move on to the next slide. There you go. Over to you
Yes.
to take us through to question 2.
Yes. So in the target, the alternative text target that we had seen in the previous slide, which focused more on risk reduction approach. So the text assumed that risk reduction approaches are possible. They can manage by risk reduction approaches, can manage HHP harms. So let's understand what are the different types of risk reduction approaches that exist and that are being campaigned for. So first one is allowing farmers or distributing PPE kits to farmers, educating farmers and convincing them to use PPE kits. The second approach is provision of safety storage boxes with locks in which the farmers can store their pesticides at the end of the day and lock it with the help of a lock that the government would provide or the community facility would provide. The third option is also community storage facilities where farmers are expected to get all their pesticide cans at the end of the day, get all those cans to the community storage facility, where the community storage facility manager will log all those pesticides. And when the farmer wants to use those pesticides again the next day, he has to go back to the community storage facility, take all those pesticides and come back again into his fields. And the third approach is educating farmers about different risk management interventions and teaching them how to read the labels and how to use those pesticides carefully. And the fourth approach is if a country recognizes that a certain chemical is an HHP, they can themselves go ahead with the bans. Why demand any kind of an international action or impose those rules on other countries? So let's delve deeper into these risk reduction approaches and understand if these really work. The first approach is PPE kits. Farmers in developing countries come from very poor economic backgrounds. Most of them cannot afford to buy PPE kits. As far as storage boxes are concerned, there was a large-scale study that was done in Asia. It was a randomized controlled trial that actually showed that in the treatment group where storage boxes were given to farmers in their homes, the rates of suicides in that particular region increased. In the treatment group region, the rates of suicides increased where the storage boxes with those locks were provided. Because what happened was that when a person was, during a moments of crisis, when a person was in their most vulnerable state of mind, the regulators or the policymakers failed in assuming that the person would not have access to a big stone or a hammer that they could just grab and unlock the storage box, which is exactly what they did. By providing safety storage boxes in the farmers' homes, we are actually allowing them to keep these pesticides, these toxic pesticides in their homes and still access it during moments of crisis, during moments of heightened suicide risk periods. They can easily break the lock open and consume the pesticides. Then the third approach was storing these pesticides in a community storage facility. The problem with that was that the community storage facility was usually very far away from the farmer's house, and the farmers didn't really think that it was worthwhile to go all the way from their fields to the storage facility at the end of a tiring day just to store their pesticides. So they never actually used the community storage facility. So none of these risk reduction approaches have really worked when it comes to reducing suicides due to pesticides. The only intervention that has worked is restricting means to most lethal means of suicides. When these lethal means of suicides were not made available to people during their worst moments, their most vulnerable moments, they did not have access to any lethal agent to take their lives, which allowed their suicide impulse to pass, and they and gave them another chance at life, another chance at counseling, therapy, and family support. And there was also a study that was done in Sri Lanka that showed that the repeat suicide rates was less than 20%. So people with low intention low intention do not really attempt suicides again after therapy counseling. So the only cost-effective intervention to address the issue of HHPs and suicides is means restriction. Can I have the next slide, please? Yes, so with this in the background, my next question is, do you think that individual countries can protect their populations and environment from highly hazardous pesticides and their harms without the support of an international mechanism? Explain your response and how this could or could not be done, and include your country. Thank you.
Thanks very much, Shweta, again, for providing important information to the participants. There are a few questions that have been coming through while you have been presenting. So I can read them to you if you are ready for that. So Debbie from South Africa asks, should PPE, so personal protective equipment kits, not be according to the pesticide exposure risk and not average usage? I'm not sure you spoke about, did you speak about PPE kits? I think you spoke more about the storage boxes.
Yes, yes.
Debbie, maybe you want to just, I'm not sure if PPE kits were mentioned, or is this something that you just wanted to raise?
I did mention PPE kits though, but I mean, the larger point was that farmers cannot afford PPE kits in most developing countries. So expecting farmers to buy PPE kits is not really something that is going to work. Most of these risk reduction approaches that are suggested are a fantasy in developing nations. It doesn't work like that, because farmers are uneducated. They can hardly read the instructions or labels that are written behind a pesticide can or a pesticide bottle. They don't have enough money. They think about their lives on a day-to-day basis. So expecting them to buy PPE kits is not something that has worked.
The other question was from Gift. What do you think are the causes of the slow implementation of conventions? So going back to the first question, particularly in low and middle income countries.
I think the first reason has to be lack in resources. In some countries that really want to go ahead with these bans, like I think most Latin American countries or African nations, they need more support in terms of capacity building, or in terms of identifying alternatives to highly hazardous pesticides. Right now, we don't have any kind of a portal, a universal portal that lists alternatives to highly hazardous pesticides. They are there, but there is no platform where countries can come together and share this knowledge. For example, if certain countries have phased out certain HHPs and they have replaced them with alternatives, this kind of information is not available to other countries who might want to take similar steps. So there needs to be a podium where this kind of knowledge could be shared. And right, as of now, we don't have that.
So we have posted the next poll on the screen, and the Menti link is in the chat. So if there aren't specific international bodies or mechanisms to support countries in terms of protecting their populations and the environment from exposures to pesticides and perhaps particularly HHPs. What are some of the challenges then that are faced by governments? Your responses are welcome, and please do continue to respond to question number 2 in the chat.
Yeah, I also see somebody has mentioned that pesticides are smuggled in Iran. More than 50% of HHPs are smuggled in Iran. This is also something that we have seen during our work with CPSP in different countries. That countries oftentimes have porous borders, and that makes it very difficult for countries to ensure stricter implementations of their policies when it comes to pesticides or any other chemicals for that matter.
So there are also some comments coming through on the poll as well as in the chat. If you'd like to respond to any of those.
Yeah, I'm just reading through.
Yeah, I know it's quite quite a lot coming through.
You can help me out with a question if you have identified any, because I'm still reading through it. So I think everybody's talking about capacity building, where in terms of there are no individuals with knowledge regarding HHPs or how to identify them or replace them with suitable alternatives. They don't have enough manpower, or they require more training and technical help. So these are all I think concerns related to capacity building, for which they are saying that they do require international support. Yeah, I think mostly everybody's agreeing that they need support from international bodies and conventions in terms of capacity building, training.
Yeah, there's also quite a few comments in relation to the need for regional capacity building and regional efforts in dealing with HHPs. I think particularly because of porous borders and also having the shared capacity to be able to make those, implement those decisions.
Yes. I would also like to comment on on this particular point on lack of resources to provide awareness raising on HHPs. That is quite true, but there are lots of studies that have been done on interventions that have been done to raise awareness amongst farmers about HHPs and best pest management practices. And there are mixed results there when farmers were informed about impact of using HHPs on their family health or environmental health, or cost to or the amount of money that they are spending because they are using HHPs instead of sustainable alternatives. There were mixed results in terms of their behavior, because behavior is often very difficult to change. and it requires more money for the government to implement. So when it comes to means restrictions, it's much easier. But I agree that before any kind of such such regulative decision is taken, it's important to prepare farmers and inform them about alternatives and help them understand that this is not going to create any problems, to avoid any kind of insecurity that they might feel.
So in the interest of time, we moved on to the second poll for the second question. In your opinion, what do you think is the first key step for addressing highly hazardous pesticides in your country? And if you can list your country, that would be helpful. So you can use the Menti link that's in the chat, or you can always go to menti.com and put the code that's on the screen.
I also see a comment from Jared from Ethiopia. He's mentioning that he's also mentioning about capacity building of personnel working in the Ministry of Agriculture. I think that's exactly what we are aiming, what we're speaking about in this presentation, that international support is required from these international conventions, whether it comes to allocation of resources or funding, to help countries strengthen their capacity or train personnel in the Ministry of Agriculture or Ministry of Environment to address this issue. There is also a pesticide registration toolkit workshop that FAO organizes, where they invite representatives from Ministry of Environment and train them on about how they can go about identifying HHPs and phasing them out. So maybe countries can also write to FAO and ask for their support. Maybe they can request FAO to invite them to these pesticide registration toolkit workshops that are organized. Yeah, these are some very interesting suggestions. Stakeholder consultations, very important on identification listings of HHPs.
Yeah, it seems there's quite a lot of responses coming through that the first step is actually identifying HHPs within the country using the JMPM criteria. And there are several projects underway. I know that FAO is undertaking several projects to support countries to do this. It'd be interesting to know how many countries are actually working on the identification without support from the FAO. I know South Africa has done theirs. What about in Asia? Are you aware of any countries that have done their identifications?
Yes. So I think in Asia, Nepal has identified a couple of highly hazardous pesticides in their region, and they have gone ahead banning it. Aluminum phosphide is one of them. Also, a recent paper that I had published for that analyzed the pesticide poisoning situation in Pakistan. There we found out that there were a lot of pesticide poisoning related suicides with respect to aluminum phosphide that were happening there. So now they are also in discussions of changing the formulation of aluminum phosphide from a 3-gram tablet to a 10-gram tablet. So 3-gram tablet is can be easily consumed, but a 10-gram tablet is not easy to consume. So those are the changes that they're going to bring about. And this was not suggested. I think this is something that has come from the countries themselves.
That's a very good example. Shweta, would you like to make any summary comments for question 2 before we move on to question 3? I know you've said quite a lot already, but if there's any last points you'd like to make before we move on.
Yes, I think that majority of us have agreed that it's not possible for countries, given the resources that they have, most developing nations have, where pesticide poisoning suicides is a problem, to regulate pesticides. And that's why they need international, they need funding in terms of help, they need funding and help from international conventions for capacity building and strengthening their existing systems, where they could also possibly employ more people in the pesticide regulatory bodies. And also, I think in this current poll, most of us are agreeing that the first step is to identify HHPs, because if you know the problematic HHPs, you can go about banning them one by one. So I think it's important for countries to engage with their regional FAO teams and seek support in identifying HHPs, because there's a lot that FAO is doing currently. And if they don't have the capacity to do it themselves, they can seek support from FAO.
Thanks. So I think we should go ahead and move on to our final question today and the final presentation from you. So over to you, Shweta. Thanks.
Yes. So I think more than 6 years ago, in the previous ICCM, in the ICCM-5, there was a resolution that was made to take action against HHPs. The UN agencies were called upon to create the global action plan for HHPs. However, nothing has happened in the past 6 to 7 years. We don't have the global action plan yet. And I think the African region realized this in the SAICM meeting in Romania, that they are possibly not going to come up with the global action plan until the next ICCM. And even if they do come up with a global action plan in the next ICCM, that would be another 10 years by the time it is implemented. So the African region submitted a beautiful proposal for a global alliance, for formation of a global alliance for HHP prevention to the SAICM conference. And this was an initiative that was taken by the African region. This particular alliance is under discussion. It is going to be discussed in the upcoming ICCM conference. This particular framework is open to all stakeholders, and it is voluntary in nature. Basically, it is going to be a mechanism for the target that we have read in the previous slides, which calls all countries to phase out all HHPs by 2030. We all know that there are always several targets in different documents and in different policy documents, national and international, but most of the times they are not implemented because they need a mechanism to be implemented. The target on banning all HHPs by 2030 is not going to be implemented on its own. So Global Alliance for HHP Prevention is the mechanism that is going to help implement the target on HHPs, which is calling for a total ban by 2030. So this is basically a a podium that is currently lacking, where countries can come together, learn, share their experiences about banning HHPs and replacing them with safer alternatives, and share that knowledge with other countries who want to take similar steps. This would also call upon different UN agencies. There is a request for this to be hosted, the secretariat to be in FAO of this particular mechanism. So majority of the stakeholders in SAICM has supported the formation for the Global Alliance for HHP Prevention. However, there are some countries that have opposed. And these are the same countries that have opposed the target or have suggested the alternative text for the same target. And a consensus is necessary for this resolution to be passed. Right now, there is no consensus. Majority of the countries are supporting it, but consensus is lacking. The countries that have opposed the formation of Global Alliance have three main concerns. The first concern is that this is an African region problem, and the African region should address it themselves. Why get it to SAICM? This is actually not an African region problem. The countries from other regions should actually thank the African region that they have brought up this proposal. This is actually a global problem. This is a problem for all those countries that have banned HHPs in their own country, but are manufacturing it and exporting it to other countries. They are a part of this problem. This is also a very big problem in South Asia. Majority of the people that are dying due to pesticide poisonings are dying in South Asia. This is also a problem in Latin America. So this is a global problem, and countries need to come together to address this problem. The second concern of the stakeholders that had opposed the Global Alliance for HHP Prevention is that African region can ban pesticides nationally. Why impose it on other countries? So this is similar to the discussion that we had in terms of the second question. Can African region ban pesticides nationally, and can they manage it well? Would the issue of porous borders arise? And I think some of us agreed to it, that it's not possible, given the capacity and the number of people that are employed in the pesticide regulatory bodies in most developing countries. It is not really possible to manage such regulatory decisions or ensure its correct implementation. And the third concern was, who is going to fund this mechanism, the Global Alliance for HHP Prevention? Why should we burden SAICM with a new issue? So these are the three questions. And my next question to you would be, next slide, please. If countries fail to reach a consensus to accept the African region's proposal for establishing a global alliance for HHP prevention at the 5th session of the International Conference for Chemical Management, what is the best way forward to continue the work already initiated to support the alliance formation? Thank you.
Thank you, Shweta. You've been very clear about the whole process and reasoning for a global alliance, and really starting out, with your first question around, and your first presentation around suicide and HHPs and the need for regulatory control, and then the possibility of having international conventions, but the current issues and problems we have with conventions being effective or not effective, and then moving toward whether we can have much more of a global approach to addressing HHPs. So thank you for that. So I do encourage people to continue to respond to this very important question, which really needs to be discussed in the chat. And in the meantime, Shweta, I'll draw your attention to Chris from Zambia's question. So he says, I participated in drafting the target. Do you think the target is realistic, knowing the challenges that are faced in low and middle income countries, so developing countries and countries in transition?
I think as far as the date is concerned, 2030, I think that part of the target might not be realistic because we don't have many years to act upon this issue. 2030 is quite soon. So maybe there could be a change in the date, but I very much think that it is very much possible to ban highly hazardous pesticides and replace them with suitable alternatives and sustainable and safer agricultural systems. But maybe there could be a change in the date.
So we have 3 last polls for this question. So the first one is up. What do you think is the benefit of having a global alliance on HHPs? And you can also continue to put your responses into the question 3 that was posed by Shweta as well.
Yeah, I agree with the suggestion that is made of filling the current gaps that conventions, agreements, and international organizations are not addressing. Right now, we don't really have any kind of a system that is providing countries the information about alternatives to HHPs. Maybe countries could come together and generate this information, share with each other and learn from each other's experiences. Also, there are a lot of agri-tech startups in developing nations that have started. And there are different kinds of agricultural technologies that are aimed at replacing HHPs. Maybe through the formation of this global alliance, they could also trade the knowledge about those technologies with each other. And I also think the global alliance, because it's so clear in its target of phasing out HHPs, it's very ambitious. And as a voluntary tool, which it is in nature, because it is voluntary, I think any voluntary instrument should be very ambitious. So that is also a great quality about the global alliance.
Shweta, I don't know if you want to comment on or what you think of Ruben from Zambia's comment about that the alliance should actually start regionally first and then move to a sort of more international and global level.
I think if it starts regionally, wouldn't it be facing the same problems that each country is facing right now with respect to funding for capacity building or strengthening their existing systems or increasing the number of staff employed in their pesticide regulatory bodies? I think a major point about collaborating internationally is also learning from the experience of different developed nations as well that have successfully replaced HHPs with safer alternatives. A global platform like that would help countries learn from countries like, especially from countries like Japan and South Korea, where HHPs have been successfully replaced. So I think if it's an international mechanism, it would have more impact in terms of sharing and learning and also resource allocation.
Yeah, I think you raise a very important point about resources. And really, we do need to keep remembering that in low and middle income countries, that lack of financial and human resources really is a key issue. So the next poll that we posted, and we can always go back to the other one if you want to see the responses, Shweta, is, do you support the establishment of a global alliance on HHPs? So you can say yes, no, or we're not sure. So there's quite a lot of discussion going on in the chat around the Global Alliance. I don't know if you want to comment on anything that you see. And at the moment, I see we have from members full support for a Global Alliance. Perhaps the nuances of how the Global Alliance would work is different from people's understandings. But in the first instance, there seems to be a lot of support.
I see Charles has commented. He said that a regional initiative might be an alternative to revert to and strengthen efforts for reducing harms due to HHPs. I think that could be a backup alternative if the Global Alliance resolution is not passed at the ICCM-5 meeting. But the question about resource allocation and funding still remains unanswered, because somebody needs to fund the mechanism. So does that mean that the African region will have to, if they have to address this issue on their own, they will have to seek funding for it from different stakeholders to act on this issue?
So Yared has drawn attention to the Global Alliance on the elimination of lead in paint and the impact that that has had, and really commenting on how when you have a serious issue impacting on health, such as with HHPs and suicide, the example you gave at the beginning, that a Global Alliance is an effective approach.
So I read a comment from Debbie. She has mentioned that the Global Alliance is a really good idea, but how to implement in different countries might be a challenge. Maybe look at it from a regional level like CDC. So I think the Global Alliance is not like a framework that is to be implemented. I think it's more of a mechanism for countries to come together and share knowledge and learn from each other's experiences with respect to alternatives for HHPs, and also to allocate funding to different countries and learn from each other's experiences about what is the best way forward to build capacity and strengthen the existing pesticide regulatory bodies.
So this is our final poll for question 3. So who do you think should lead the Global Alliance on HHPs? And I know it's very small on your screen, but when you actually go into menti.com, you'll be able to read them much better. So it lists the different United Nations organizations, including the IOMC. It lists countries and other stakeholder groups. It appears that people have been able to choose more than one. So it's going to be quite a challenge to tease out who should actually lead. At the moment, it's the FAO and countries that have successfully banned HHPs and replaced with alternatives. Those seem to be the leading ones.
Mhm.
At the moment, there's quite a few comments in relation to the fact that a global alliance is still a voluntary process and that it's not legally binding, and this need for having legislation. So do you think a global alliance would encourage countries to move forward with stricter legislation in regard to HHPs than what we have in place at the moment?
Yes, I think it would, because we have seen this kind of we've seen this kind of a movement for lead in paint, where countries, it took a lot of time, but where countries have come together to agree on it. So, but there is a particular problem with respect to HHPs, because this issue is a bit different. It involves much more stakeholders. Health, chemicals, the industry. So that's why it's a much complicated problem, but I think it will make a difference.
And what do you think about the responses that people are giving at the moment in relation to the poll on the screen?
I agree with it. I think the FAO, UNEP, the IOMC organizations, and the countries that have successfully banned HHPs and replaced it with alternatives, all these organizations should be a part of the Global Alliance. But in terms of leading it, I also think that FAO would be the correct organization to lead the organization, because this is the expertise that they have. They have a number of initiatives and programs that they have organized to help countries identify HHPs, like the Pesticide Registration Toolkit Workshop. They have published several documents regarding identification of HHPs. There are guidelines that they have published. They have the necessary expertise to address this issue. They have people working in their team who would be the correct people to inform other countries about this issue. So I also think that the FAO would be the ideal organization to host this, to host the Global Alliance on HHPs. Oh, now we have more people who voted. We have UNEP. We have a tie between FAO, UNEP, and the IOMC and countries that have successfully banned HHPs. Okay.
And Shweta, what do you think of Brian's comment, where he says that he thinks the Global Alliance should be a coalition of institutions with a rotating chair, rather than one lead organization, which could be problematic?
I think that is a good suggestion. I think that is a good suggestion because it allows different organizations to have a say, and it would also, I think it would also result in different approaches over a period of certain years whenever the leadership would change, if it would change. That's a very good suggestion, because I think every UN organization has a different perspective. While we've seen this in SAICM and Rotterdam, FAO or WHO have been a bit silent about this issue, but ILO has been very vocal about their support, both for the Global Alliance and Target A7. So there is a difference in the level of approaches of each of these organizations, given the issues that they address. So I think maybe like there could be a change in leadership, but we could also have a combination of two different types of stakeholders at the leadership level, not necessarily one person, but maybe two organizations from different backgrounds leading the movement. For example, FAO and UNEP will be focusing on environmental issues. FAO will be more technical, and if each of these UN organizations have their own technical expertise. So I think that's a good suggestion.
I agree with you. We are coming to a quick end to a very important conversation. So I just want to ask you if there are any last comments you make before I conclude. You have covered a lot and we have gathered a lot of information. So thank you for that. Shweta, I can't hear you, but I don't know if there were any final comments that you wanted to make.
I wanted to thank University of Cape Town for giving me this opportunity, and I also want to thank all the participants of this session. They have engaged in very interesting ways. Some of the comments and suggestions that they have come up with are very interesting takeaways for me, something that I'm going to go back and reflect upon, and also include in my discussions with the various stakeholders during negotiations at SAICM. So thank you very much, everybody, for attending this session.
So thank you very much, Shweta. You're a wealth of information, and we really appreciate the effort that you made for putting this together. And as you highlighted, a lot of discussion has been stimulated and some good food for thought. So thank you to all the participants. Thank you to Natasha that was in the background. Thank you also to Naomi. Just to remind you, if you want to get the slides, the recording, and the digest, make sure that you have signed up. We also do have a bi-weekly pesticide newsletter with resources and information, so make sure you've signed up for that as well. It's in the chat. And to draw your attention that our next discussion will be on the 3rd of August. At the moment, we're looking at possibly discussing online sales of pesticides, but we will notify you in due course that that will be the topic. So thank you again to our presenter, to Shweta, and to all of you, and we'll see you on the 3rd of August. Stay safe and bye for now.